Hello, and welcome to another episode of Social Workers Rise. It is your host, Catherine, here. Today, we're going to be talking about anxiety, understanding anxiety, and what you need to know as a social worker if you are working with literally anybody in this field and for yourself. Because as a social worker, you are going to be exposed to very high levels of anxiety producing situations. Even in grad school, getting your bachelor's degree, internships, there's going to be a lot of crazy things that may happen that produce anxiety for you and for your clients and your colleagues. It's important that you know the basics, right? We're not going to go over the entire definition of anxiety because you can read the DSM for that, and that would make for a really boring episode. I want to just give you the overview, some statistics on what you need to know as far as how prevalent anxiety is, and share some of my own personal experiences. If you don't know about me, my name is Catherine Moore. I am a licensed clinical social worker. I'm based out of California. I'm also a clinical supervisor, an author, a keynote speaker, and clearly a podcaster. I do also have courses that I have created specifically for social workers who are interested in career development opportunities. Make sure, if you're interested in any of that, subscribe to the email resource newsletter. I call it my Friday resources because sometimes when I'm doing good on Fridays, I will send out updates about things that are going on in the field, events that are coming up, discount codes, freebies, cheat sheets, lots of really great information that I think you would benefit from as a social worker. Okay, let's hop into this. Anxiety is near and dear to my heart because one, I am an anxiety specialist. Two, I have worked with a lot of people who have experienced anxiety. And three, I experience anxiety myself. There have been plenty of moments that I have scored high on the anxiety assessment test and have sought therapy, right? No shade. This is totally normal. In fact, over 19% of adults in the US have experienced anxiety in the past year. Meaning, if you have a room full of 20 adults, 19 of them have experienced significant anxiety, and the majority of that 19% would be women. All right. So, this is very common for women. And a lot of times, how it showed up for me and how it shows up for my clients is just immense feeling of overwhelm, or like this constant feeling of I'm not enough, I can't do enough, I must do more, I feel like I'm always failing, I'm forgetful, I just can't today. So there's a lot of that going on, and if that is you, you are in the right place, my friend. And if that is not you, please stay, because I don't want it to be you in the future. And if you meet clients who are feeling like this, I want you to be able to be there to help them through this process. All right. So today, I really just want to give you the foundational knowledge to recognize, understand, and support people who are experiencing anxiety, including yourself. All right. First, I want to be very clear. Stress and anxiety are two different things, right? Stress is totally normal and even healthy. It can be motivating. It can motivate us to get things done. For example, if you're experiencing stress over a exam that's coming up and you're thinking, oh my gosh, I need to study because I need to pass this test because blah, 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 right? Or you're experiencing stress over a paper that you write or presentation that's coming up, this will motivate you to get shit done. All right. Sometimes without this stress, without those deadlines, we would just never do it. So stress can be a good thing. And really what stress is defined, it's a short-term response to an identifiable event or trigger, right? It's our body's reaction to a perceived challenge or a perceived threat. And once this threat is gone, the stress goes down. For example, tests, presentations, if you have bills due, if you have an upcoming event, if you have an upcoming travel plan, right? All of these things can create stress, but once that thing is done and it is past, so too has that stress. And you no longer feel that stress, you feel more relief after it's gone. This is different than anxiety. Anxiety is much more long term. In fact, the DSM says that you would have had to experience symptoms for the past 6 months or more, right? It's more internal. It's a constant worry, it's an unease, it is nervousness, and a lot of it is about something that may happen in the future. And these things may or may not happen. Sometimes we can have ruminating thoughts about all of our worries and, oh, what if this? And what if that? And then what would I do with this? And then the world ends, right? We can just spiral down until we just drive ourselves nuts. So that's the difference with anxiety. For example, I would see anxiety a lot in the healthcare system. For example, I had one person come to me, and it wasn't even the patient, it was the patient's spouse. And this spouse said, I'm so grateful that the cancer is in remission. In fact, it's gone now, but I'm just so worried it's going to come back. And I can't help but think, okay, what if it does? What if it doesn't? Then how do we do this? So this spouse was worried about the unknown, something that may never happen. There's not an identifiable event in the future. This anxiety is just ongoing. And it was taking away from her life. It was taking away from special moments. And I asked her, I said, what do you ultimately want right now? And she says, well, I want my partner to be cancer free. I said, exactly. They are cancer free. And it clicked for her, saying, oh my gosh, the thing that I am so worried about has already happened. And I don't know if it'll happen again. It may never happen again. Right. So it helped to bring her back into the here and the now. That's just one example of someone that I worked with that was experiencing anxiety. I do want to normalize that having some stress and some anxiety is a normal part of life, but it's when it becomes excessive, persistent, and when it starts to interfere with how you're doing life, then we're going to be talking about an anxiety disorder here. And there's 12 different types of anxiety disorders. I'm going to give you the top 6 that are most common. So most common is going to be the generalized anxiety disorder, or GAD, GAD. And this is really classified as a persistent and excessive worry about everyday activities or events, often to the degree that interferes with daily life. So the way that I see this show up for my clients, there's a lot of rumination, a lot of fear around what if this happens? What if that happens? I don't know what I'm going to do. And so it's ongoing. It stops them from enjoying the moment. It distracts them. They can get in trouble at work. They can make mistakes. They can start missing school because of, well, what if I wear the wrong thing? Then so-and-so is going to say something, and then this is going to be terrible. And then and so they spiral, right? Another one that's pretty common, general anxiety disorder is the most common one that I've seen out of the anxiety disorders, but there's more, and I'll give you a little breakdown of the other 6. Panic disorders. This is characterized by sudden, unexpected panic attacks that are accompanied by intense fear and physical symptoms like a racing heart, shortness of breath, and dizziness. I had this happen to me when I was in college. I had gotten out of one of my classes and I received this panicked phone call from one of my family members and says, Catherine, I saw this on the news. Is your family okay? And this triggered one of my fears and related to a past trauma. And I started feeling all of these things. I could feel my heartbeat. It was pump, 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 pump. I couldn't catch my breath. I'm like crying, but I can't really breathe. So I can't really cry. And then I can't think straight. And all I could focus on was, oh my gosh, I must reach my family member. I could not think about anything else. And it was very scary. And this lasted probably, I don't know, maybe 20 minutes because I remember walking across campus because I still had to go to my social work classes. I was walking across campus crying, can't breathe. I looked like a hot mess. Okay. It was terrible. So that's that. But I will mention that there doesn't have to be a trigger. So for me, there was a clear trigger, but for other people, panic attacks can just happen unprovoked, out of nowhere. And this panic that comes on unexpectedly can create more anxiety for people. I've talked to people where they say, well, what if I have a panic attack at the party and then I'm so embarrassed and I don't know what to do? I couldn't live with myself. So things like that. So the panic disorder can create more anxiety, right? Social anxiety disorder is the next one, also known as a social phobia. And this involves intense fear and anxiety in social situations, fearing embarrassment or negative judgment from others, from your peers. I've seen this a lot with teenagers, and social anxiety has become much more prevalent since 2020, since COVID, and also honestly since the rise of social media. Because I've talked to probably every teenager I've ever met recently, and yeah, they are worried that if they show too much of themselves, if they're vulnerable, if somebody videotapes them dancing and having a good time, that this is going to go viral and it's going to be social suicide, and they just can't bear the embarrassment. So they withdraw, they come into themselves. And I've seen this as the effects being that they can't really express who they are. And so it's hard for them to really develop that sense of personality, that sense of self, because there's always this worry of, what are people going to think? Is this going to be on the internet? And just a lot of fear, right? There's also specific phobias. So this is going to be an intense and irrational fear of a specific object or situation that poses little or no actual danger. There's also separation anxiety. So anxiety and distress when someone is separated from their home or specific people, or specifically with children and teenagers, maybe they're separated from their parent, from their pet, something like that. And then there's selective mutism, which is the child's inability to speak when they're in social settings, despite being able to speak in other situations. All right. So that is the list of the top 6 most common anxiety disorders for your reference. If you are suspect of any of these disorders about a client, someone that you know, you can find the official definition in the DSM. That's like the Bible for all of our mental health diagnoses. So anxiety is on the rise. In 2024, 43% of adults say that they're feeling more anxious than they did in the previous year. The most at-risk populations are going to be young adults, ages 18 to 29, especially college students or those who are making a transition into a new role. I do work a lot with this age population because there's so much change happening. There's just so much going on that it's hard to navigate. And, it's natural to think, oh, okay, I'm going to be graduating for college. What's next? What about this? And then, oh my gosh, what if I don't get hired? And then I'm living on the streets and I'm homeless, right? So it's easy to spiral in these things because there's so many new experiences. And if this is you, because I know that there is a big population of listeners that are between the ages of 18 to 29, graduating college, you're making this transition. Maybe you're even going into college. Maybe you're starting your social work program, and there's just so many new things. Meeting people. What are you going to do if this, if that? Am I going to be able to balance my responsibilities? I know a lot of us are working full time to support ourselves. Maybe you have family that relies on you. And now here the school is talking about your classes and your internship that you need to do for those classes. It's a lot. It's a lot. And you need to make sure that you are in the best place possible, that you have a good foundation, and recognize that the level of functioning you were at before your college program is going to change. There's going to be some things that have to sacrifice that you're not going to be able to do while you're in school because there's just not enough time or energy to do this, right? It does take some planning ahead. Also, another high risk population are teenagers. Between the ages of 13 and 18 years old, about 31% of them, almost 32%, are affected by anxiety disorders. That's a lot. And research shows that untreated teenagers with anxiety disorders are at higher risk to perform poorly in school, to miss out on social experiences, and to engage in substance abuse. Another high-risk population is women. Women are twice as likely as men to experience anxiety. Individuals with a history of trauma, either in their childhood and or current trauma. There's a lot of people, I think most people that I talk to now that struggle with anxiety do have some sort of trauma, either in their past or current, that they are struggling with, that are making the anxiety a lot worse. Another high risk population, BIPOC communities, LGBTQIA plus individuals, and also helping professionals. Yes. So social workers are at a high risk for anxiety. With all of this being said, it is important to be aware of trauma-informed and culturally sensitive practices when working with clients. Because given that there could be a history of trauma, just assume that somebody has been traumatized in their past so that you're making sure that you take the appropriate steps. Though, my pet peeve is when someone says, oh, well, I didn't use trauma-informed care because they didn't tell me that they had any trauma. Okay, a lot of problems here. People do not need to reveal their traumas to you and should not have to reveal their traumas to you in order to be treated in a respectful, trauma-informed manner. If I just meet you and I don't particularly trust you or know you, no, I'm not going to tell you about the worst moments of my life. That's just not going to happen. And also, too, some people do not know that what they have experienced in the past constitutes as trauma. Sometimes trauma in communities has been so normalized that they think it's normal and they don't realize that it is traumatic. For example, I worked at an after-school program in Compton, California. It has a really high violence rate. And I worked with these kids they were 5 to 11 years old. And they would come in and tell me, oh, so-and-so got jumped the other day. I saw them. They had to go to the hospital. Or my friend got shot at the corner store and I saw the person drive away. I heard the shots. So they didn't even register that these are traumatic events But as a professional, I know that they are. And so therefore I'm able to step in and provide trauma-informed care. But that's just an example of how people may not know. If you're growing up with childhood abuse and your mom experienced it, your mom's mom experienced it, and now we're talking about generational patterns here, you may not know that that's not normal, right? Being aware is your responsibility as the professional. We're going to talk about some common symptoms related to anxiety disorders. They are not going to be super in-depth detailed because I listed 6 common ones and they all have their own specifications. But generally speaking, with anxiety disorders, we're going to be looking at emotional symptoms, physical symptoms, and behavioral symptoms, meaning you're going to see someone with a constant worry, restlessness, fear of losing control, a feeling of overwhelm. Physically, they might be experiencing increased heart rate, headaches, muscle tension, even stomach issues, having to go to the bathroom a lot, stomach pains. Behavioral, you might see just a social isolation, avoidance, irritability, a trouble with concentrating or focusing, sleep problems, either having trouble falling asleep or not being able to stay asleep or fall back asleep, and thought rumination, meaning that their thoughts are just going so fast. They have racing thoughts and it can keep them up at night. It can wake them up at night. It keeps them from focusing on their schoolwork, in class, at their job. A common way to assess for anxiety is using the GAD-7. That's an assessment tool. The Generalized Anxiety Disorder 7. It is a questionnaire, 7-question questionnaire that gives you a score at the end of how severe the anxiety is for that individual at that particular time. That is easily accessible. You can always Google that and you can get the PDF and the scoring for the GAD-7. That's GAD-7. All right. Next up, and lastly, we're going to talk about treatment options for anxiety. So, one, and the place that I like to start out with people is just lifestyle changes. Are there ways that we can make changes to your lifestyle that reduce the anxiety, that help to bring about more calmness and more peace? Are there ways that we can integrate breathing and exercise and making a sleep routine and journaling into your daily habits so that you can manage the stress and your nervous system has a chance to just breathe, just to come back down? I'll tell you my pet peeve, another pet peeve is people will message me and they'll say, Catherine, I'm feeling so anxious, so overwhelmed with what's going on. And I'll say, oh my gosh, that sounds terrible, because it does. And, what have you tried to manage your anxiety? What have you done so far? And they'll say, nothing. I don't have time. And I say, okay, I hear that because I get it. I've been there, done that. But I do have ways that you could integrate self-care into your schedule without adding more time, more things to do. And they don't like that for some reason. People just like ghost me after I say that. And I don't know what they were expecting me to say, because you ask a therapist what to do about your anxiety, then I tell you, hey, try these things. And they say, no, I'm just going to be anxious forever. Like, okay, well, if you don't believe that you can change, then you're right. But I will tell you, there are some really, really simple, effective ways to manage anxiety on a nervous system level. So I really enjoy somatic therapy, meaning how to tap into the body and the nervous system to just bring it down. Because the way that our brains work, and I explain this to my clients, is when we're stressed and we're anxious, our brain recognizes that and sends out signals and stress chemicals into our bodies, and they live in our muscles. And they're there. Even after the stressful event has ended, after the anxiety has gone down, the chemicals have already been released. They are there, my friend. And now it is up to you to process these emotions. And people don't like to hear this, but it is true. The fastest, most effective way of processing these emotions and getting them through and out of your body and getting your nervous system to just chill out is exercise, movement, walking. Walking for 20 minutes will do you wonders. I promise. Breathing, because when you're anxious, our bodies are holding our breath because we are in fight or flight mode. We are activated. The breath is short and shallow. And when we live in this state of short and shallow breathing, we're not getting oxygen in, and therefore our nervous systems react further, say, oh my gosh, we have a lack of oxygen, freak out more, right? So if we can just take some deep breaths, this doesn't take any extra time. So anyone telling me I don't have time to breathe, you are full of shit, my friend. Just being real. Because while you're driving in your car, while you're walking to work, while you're walking to class, while you're taking a dump, you can breathe. Okay. The key here, I'm going to give you some secret sauce, is taking long, deep breaths. Breathe in through your nose, bring the air into your belly, try to feel your belly expand, and then breathe out a long, deep breath through your mouth. And do this at least 5 times. You may need to do it more if you're having a really hard time. But if you're able to just continue to breathe, especially when you are feeling activated, feeling triggered, thinking about this breath coming in through your nose, into your belly, filling up your whole body and releasing it, releasing all the air out and imagining all the stress just leaving your body with each breath. That's going to do wonders. When you try that, message me and tell me how it goes for you. All right. So, first off, altering lifestyles, right? Breathing, grounding techniques, exercise, sleeping, journaling, just things to be a healthy human, right? Beyond that, there's therapy, very effective therapy techniques. So if you are somebody who wants to learn more about this, who wants to be able to help people with anxiety, there's cognitive behavioral therapy, or CBT. That's a lot of what I use, and it's considered to be like the go-to or the gold standard for anxiety. There's exposure therapy, DBT, dialectical behavioral therapy, ACT, and then I also tend to use a lot of somatic and mindfulness based therapies. These work wonders and they just do so much, and they're very quick, very effective. For example, I had a person come in to the medical office and I was talking to her and she was experiencing so much anxiety. She was talking super fast. I could tell she had racing thoughts. She was spiraling. She wasn't breathing. She's like going down this deep well of what ifs. And I just said, okay, I'm going to need you to pause. Just pause. I interrupted her. I know, rude, right? But I could tell this conversation was not going anywhere. It wasn't helpful. And she was just spiraling. So I said, okay, I'm going to need you to pause. She's like a little caught off guard, like, okay. And I said, take a deep breath in through your nose. Exactly what I just said, right? Into your nose, into your belly, and breathe out. I had her do this only 3 times. And she said, oh my gosh, I feel so much better. And then we were able to have a conversation. Because when people are coming in, when they see you as a social worker, they may not know you and they might be scared. They might be spiraling. They might be really anxious. And you can see this in their body. They're tense. They're not breathing. They may not be making sense in their talk. If you can just have them breathe and bring them back, this is a mindfulness piece, right? Just bring them back to the moment. It can help with the conversation. It can help you have a much more effective session, right? So beyond therapy-based interventions, beyond lifestyle modifications, there are also medication that you can talk to your doctor or the psychiatrist about. Also, too, there's faith-based and holistic interventions as well. There's been studies that have shown that people who read their Bible, whatever their Bible might be for them, read their Bible on a regular basis, experience much less anxiety because they have this sense of purpose. They have this hope. They have this positive word feeding into them. So spirituality can be extremely effective in reducing people's anxiety. It just depends on the person, right? So for you, make sure that you're kind of just aware of how you're feeling. Check in with yourself. There's no judgment. This is very, very common to experience anxiety, especially being in your 20s, being in a new role, starting a new job, meeting new people, meeting new clients. Everything's new. We don't really know what we're doing quite yet. And that is okay. That is okay, my friend. So I just want to normalize this for you that if you are feeling that, it is okay. If you need extra help, cool. It shows a lot of courage for you to reach out and to be like, hey, I just need some help with this. I need some tools. And by you doing that, you're normalizing it for your clients and you're able to speak from personal experience. Like, hey, exercise has been helpful. Deep breathing has been helpful. Mindfulness has been helpful, right? You don't have to share you personally, like, hey, I did this, but you're able to say, well, I'm aware that such and such intervention is there, or I'm aware that if you have strong social supports, that can really go a long way, right? So that was the other part as far as the socialization and the lifestyle changes is tapping into other people. When we're able to feel emotionally safe, when we're able to vent, when we're able to spend time with others, that goes a long way for our nervous system too, and helping us feel part of a community and helping us feel safe and able to relax again. So I hope this was helpful for you. If it was, please share it with somebody, share it with a colleague, text it to them right now so that you don't forget. If you haven't yet already, please make sure that you subscribe to the Social Workers Rise podcast. And if you've been listening for a little bit and you love the podcast, I would love it if you can give me a 5-star review or just leave a comment on the podcast about why you listen to the Social Workers Rise podcast and what you get from it. What do you like about it? Also, feel free to subscribe to the Friday Resources email list. Check out the resources that I have on there. There's courses for social workers. If you are going into clinical social work and you need more guidance around topics like documentation, care planning, treatment planning, using CBT with clients, writing notes, doing psychosocial assessments, then I have one course for you, all of that wrapped into one. It's called the Clinical Essentials for the Future Therapist. Make sure to go check it out. It is well worth the investment. I promised you, my friend. Also, I did create the Rising Social Work Clinician book. It is a clinical supervision log and resource book for those of you who are in supervision and need a way to track your hours, to stay organized, and need a tool to take with you either in the field or to your supervision meetings in order to make sure that you're on the right track and that you're ready for that licensing exam at the end of your supervision. So with that, I thank you so much for being here and for the work that you do. The work that you do is so powerful, so impactful that you just don't even know. You don't even know, my friend. So keep it up. Take care of you, and I'll see you next time.